The aortic valve and the aortic root are linked structures that play a crucial role in the heart's function, ensuring the one-way flow of blood from the left ventricle to the aorta, and hence to the rest of the body. The aortic root serves as the anatomical foundation for the aortic valve, connecting the heart to the systemic circulation. It is a sophisticated structure composed of several components that work together to support the function of the aortic valve and ensure efficient blood flow. Upon examination of the aortic valve, we can see that similarly to the pulmonary valve, it has three cusps, and that it is positioned next to the mitral valve, guarding the aortic orifice. The aortic orifice is a circular aperture positioned near the mitral valve orifice, from which it is separated by the anterior cusp of the mitral valve. As mentioned earlier, the aortic valve has three leaflets: the right coronary leaflet, the left coronary leaflet, the non-coronary leaflet. The right coronary leaflet. This is the leaflet that is positioned in front and to the right. The left coronary leaflet. This is the leaflet that is positioned in front and to the left. The non-coronary leaflet. This is the aortic valve leaflet that is positioned behind. A closer look at the aortic valve's semilunar leaflets reveals structured components essential for its operation. At the core of each leaflet, positioned midway along the free margin, is a central nodule. This is known as nodule of semilunar leaflets, or nodule of Arantius. Next to these nodules are the lunules, crescent-shaped areas that extend from the nodule along the free margin of the leaflets. These lunules allow the valves to seal effectively and prevent backflow of blood. Moving further, we can see the commissures. The commissures are the areas where the edges of two leaflets meet and adjoin with the wall of the aorta. This junction is fundamental to the cohesive operation of the valve. Exploring the area surrounding the aortic valve reveals the presence of the aortic sinuses. The aortic sinuses, also known as the sinuses of Valsalva, are three widenings located at the base of the aorta. These sinuses are crucial for heart function, with two of them serving as the origin points for the coronary arteries. The sinuses are named the right sinus, the left sinus, and the posterior or non-coronary aortic sinus. The unique structure of these sinuses allows for the effective distribution of blood, including the essential delivery of blood into the coronary arteries which supply the heart muscle itself. The right coronary aortic sinus is the one positioned on the right. It gives origin to the right coronary artery. Similarly, the left coronary aortic sinus is positioned on the left, and it gives rise to the left coronary artery. The non-coronary aortic sinus, positioned behind the right and left coronary sinuses, it does not give origin to any coronary artery and is sometimes referred to as the non-coronary sinus and cusp. Taking a closer look between the aortic sinuses, we can observe the interleaflet triangles. These are fibrous anatomical structures situated at the base of the aortic valve leaflets, where the leaflet edges meet and attach. During ventricular systole, the phase of the cardiac cycle when the ventricular muscles contract, the aortic valve opens. This opening is crucial to allow blood to flow from the left ventricle into the aorta, and subsequently to the rest of the body. Conversely, during ventricular diastole, the phase when the ventricles relax, the aortic valve closes. This closure prevents blood from flowing back into the left ventricle from the aorta, ensuring unidirectional blood flow and maintaining systemic circulation efficiency.